Hi, my name is Kacy Seynders. I'm a physical therapist here at Precision Performance and Physical Therapy. We are located in the Metro Atlanta area near Emory, in the Druid Hills area. And so we're pretty accessible to a lot of the Metro Atlanta area, and we specialize in treating runners and triathletes. It's what we do all day, every day, so we absolutely love people who like to get out and get moving on 2 feet. So I'm here to talk a little bit about running injuries, some of the most common ones, what to do about them, what to look for, just some basics just so that you guys know when to seek help and what to do when injury does strike. Hopefully it doesn't and you stay happy and healthy on the run. So I'm going to start kind of top down here. So the knee is a common place. I know your aunt or grandma might tell you that you're going to ruin your knees by running, and it's not true. We have a lot of research to back that, but anyway, it's one of the most common places that we see people come in with pain in the knee. And so we can talk about different categories of knee pain. So we have like IT band syndrome, or more front of the knee pain like patellofemoral pain syndrome, or something we might call runner's knee is more commonly said. And a lot of times the knee, I tell my patients, is sort of a sandwich joint. So it's stuck between the hip and the foot and ankle. So we're treating the knee directly. We're trying to decrease pain in the knee, but we're oftentimes treating the hip or the foot. So the key for knee pain is to make sure you have good control of your hip and foot. So you might have seen loop bands like this. You can do a lot of hip strengthening exercises with this. And I'm all for your bridges, your clamshells, all those really basic exercises. I think they're useful. But the biggest thing with knee pain is that we need you doing exercises in a standing position, because that's going to be most functional for and most translatable for running, right? So because you have to be able to control your hip and your knee. I just pointed at the wrong body parts. Your hip and your foot at the same time. So this looks like lunges, squats, single leg deadlifts is probably one of my favorite exercises. Actually, the single leg deadlift is going to be a great exercise for no matter what condition I'm talking about. And it's an exercise that I really spend a lot of time teaching my patients. So I kind of went from the back door here. So what is the problem, but then what to do about it. But so what is IT band syndrome, right? So IT band syndrome we usually think of as a pain on the outside of the knee, and it can also occur on the outside of the hip. And so the bottom line here is that there's some sort of tightness or pulling happening on the outside of the leg. So again, like I've talked about, controlling the single leg part of running is going to be important for decreasing risk of injury in this part of the leg. Because if we have our pelvis moving around, our foot collapsing in, that's going to affect the stress across the knee. And this runs true for both the other knee conditions as well, so patellofemoral pain syndrome and runner's knee. But for IT band specifically, a lot of times we're talking about that control of the pelvis in single leg stance. So again, most important thing to look out for here is going to be pain in the outside of the knee. You might feel some catching or kind of clicking across the outside of the knee specifically. This isn't a click in the front of the knee, but more on the side of the knee. Tension that seems to go from the hip down to the knee. And then usually people will report a really sharp pain on impact when they're running with IT band syndrome. Because that's when there's maximum compression of the IT band across the knee, is when you're in that full extension to about 30 degrees of flexion here. And that's kind of the beginning part of your step and running gait. So it's usually a sharp pain. It can be dull or achy in nature, but it's usually sharp, and it's usually worse going downhill, because that's when the quad has to work the hardest. And so that is going to be more characteristic of IT band syndrome. So even though the treatment is very similar, we'll talk about more specifically pain in the front of the knee. So this is often characterized by more of like a stiffness or sort of an elusive pain. A lot of times people will tell me that it's in here, but it kind of moves around. It feels like it's under my kneecap is a common descriptor. And so again, it's very important to be able to strengthen your hips and your foot in this position, in this situation as well. The big thing I see with more of a runner's knee is that running cadence and running form have a really big impact on this condition. And the reason why is because if you're overstriding, if your cadence is too low, you're gonna land with a little bit of a stiffer leg. And so that just increases the joint forces from the ground up through the body. So through the ankle, knee, hip, and even into the lower back. So with these people, I'm gonna obviously watch them run, make sure that that is their problem, that is what needs to be corrected. And then we'll use some cadence cues like a metronome or just feedback from the watch that they get after their run. And then we will do some hip strengthening as well. But we'll look at what cadence, and we want that knee to be nice and soft upon landing. And so again, having the strength to be able to control that is going to be important. So we kind of have to put those treatments together. So that's pain in the knee in a nutshell. So we'll move down to the foot, and the two most common ones that I see in the foot, or common injuries I see in the foot, are plantar fasciitis and Achilles tendonitis. Both of which are very broad terms for either pain in the heel or bottom of the foot, and then pain on the back of the heel or in the calf area. So the key with both of these conditions are actually to find the right exercises to stress the tissues that need to get stronger. So you might have seen for like Achilles tendonitis, where you might read like Runner's World articles or things like that, where they recommend heel raises, which I know for some people seems really counterintuitive, right? You're like, well, my heel hurts, why would I do an exercise that actually uses that muscle tendon unit? But that's actually the stimulus that area of the body needs to get stronger. Because what happens in a tendon injury, no matter where it is, if it's in the hip, the knee, the foot, and ankle, shoulder, anywhere, is when we get a tendonitis type of condition, fibers that were once nice and aligned in a parallel manner become a little bit more tangled and don't function as well. So what this feels like is like a knot in the tendon, and so you might actually get a little bit of a bump on your Achilles tendon if you have a progressed case of Achilles tendonitis. So what the loading does, so doing the heel raises the proper way, is takes the fibers from here to here, and that way we can strengthen the tendon in a nice position like this, and it is able to tolerate the load in the direction it's supposed to tolerate the load while you're running. So that's a big one for really both Achilles tendonitis and plantar fasciitis. For plantar fasciitis, I will have someone do their heel raises with a towel rolled underneath the ball of their foot. So this just puts your foot on a little bit more of an incline and will stress the plantar fascia a little bit more in that good way that I was talking about before. The other big thing with foot and lower leg injuries is control of pronation. And this is a talk I give actually to the Atlanta Track Club elites all the time. And I've given it over and over again because pronation is always talked about as this bad thing or something we want to control or we want to prevent. We don't want to prevent it, we want to control it. Pronation is actually really, really important for absorbing force from the ground. So if we don't pronate enough, we're actually increasing the forces that go up through the rest of the body because our foot isn't absorbing it properly. So that's a less common problem though. What we see more common is overpronation. And so this is something you might have heard your sales associate at a local running store, like at Big Peach might have said, that you overpronate and therefore this shoe is more appropriate for you. And so what overpronation is it's an inward collapsing of the arch and ankle. But the key here is there's too much pronation, but there's also pronation that can happen too quickly. And so again, doing standing exercises where you're practicing a strong arch and a good foot sort of stable base is going to be really important for learning how to control that pronation in running. Because this isn't something you can really think about consciously, but you can improve your control of pronation by just doing the strengthening work for the muscles of the lower leg. So those are sort of the main takeaways there. Some things you can do sort of in a pinch, especially if you're dealing with plantar fasciitis or Achilles tendonitis, is use a lacrosse ball or a foam roller, and you can use this on the bottom of your foot for the plantar fascia, and then also on the calf, respectively, to get at some of those knots and trigger points that are affecting your foot and ankle and might be causing some of the pain that you're having, actually. So that's a quick rundown of running injuries. So a little bit about how I treat running injuries and a little bit of the kind of bigger picture thing here. So the most important thing in treating runners is watching them run, so doing a gait analysis. And so if you're going to PT and not seeing the results you want and they haven't looked at your running gait, that can really likely be one of the big reasons why you aren't getting better, because the running gait is where we see you in your natural environment and we see you doing the activity that supposedly caused the injury in the first place. And so there's things we can pick up there, and a lot of the time it's really easy fixes. Like I said, cadence, really simple cueing, and it doesn't always mean you have to change your entire running form, but it can tell us what muscles are tight, weak, and what exercises are going to be most specific for you to be able to run pain-free. So the gait analysis is a really big key to what we do here, and it's I think a really big piece of the puzzle. And then the other thing is I really try to get my athletes and my patients strength training. So this doesn't mean you have to go and lift super heavy. I do like to get some of my more advanced runners to lift heavier, but this can be a simple routine at home. I don't want it to be super intimidating or to really take up a ton of time, but it does have to be consistent. So 3 to 4 times a week, 15 to 20 minute routine. And so I work with my patients to figure out, okay, how much time can we budget for this? What days within their training plan are going to work for this? And how are we going to make this happen so that it's not too much of a burden in their daily life? So strength training is like one of those broad terms that I think a lot of runners know that they should do, but it's such a broad term that they're like, okay, what do I do in terms of strength training? And so again, I think a theme that I've talked about a lot here is doing exercises standing. If you look at your strengthening routine and it's all lying down or on a mat, like I said, those are good, like it's better than nothing. But I really want to get people up in a standing position because it's going to be most functional for running and injury prevention when running. So strength training is something that I teach people how to incorporate in a safe way, in a way that's not going to affect their running too much. Because the other thing people are worried about is being too sore. So we figure out a way to finagle that into their life. And then I'd really be remiss to say a lot of running injuries are not only due to biomechanical factors and weaknesses, but also stress. So you might have heard some coaches say, stress is stress. The body doesn't know training stress from life stress. So I often will have patients come in and they're really frustrated. They say, I haven't changed anything about my training. I haven't done anything differently. And I've been running for X amount of years, no problems, and this injury's happened now, and why? And, sometimes it is just, things happen, and I tell my patients, like, there's not always a reason why, but I've seen life stress cause running injuries with identical type of training stress, identical biomechanical stress without any changes. So we often pick that apart, and I think, that's something we don't really have control over, but it's something we have to look at our training plan and modify as needed so that our bodies can recover from all the types of stress that might be in our life. And then the last thing I want to talk about is maintenance and consistency in doing some sort of muscle maintenance. So there's a lot of options out there, especially now. There's so much technology in terms of muscle recovery. But so I'm going to talk about foam rolling, lacrosse ball, which is what we've already talked about a little bit, and then your massage gun, so Theragun, Hypervolt, whatever brand you happen to have. And so all of these have a little bit of a different effect, and I'd rather you do something rather than nothing. So if foam rolling is absolutely the last thing on earth you want to do, and you can at least use a massage gun, I'll take it. But I do tell my patients, and I do advise to combine the massage gun with some sort of trigger point release with a lacrosse ball or a foam roller. And the reason why is because these are both have a sort of pressure aspect to them, which can really help smooth out the fascia and improve the mobility and blood flow and all that stuff, good stuff that we're looking for when we are using these various tools. So the lacrosse or the hypervolt urotheragun is going to be the easiest option. You can literally lay on the couch and just use it as often as you need to until the battery runs out. But the thing is it's not the same as using a lacrosse ball or a foam roller. And so there's obviously different techniques for the entire body, but the big takeaway here is a lacrosse ball is going to be a little more pinpointed, right? So it's got a smaller surface area. So if you've got like that one knot in your calf or maybe in your glute or your quad, you can use the lacrosse ball to really get at that point. And so I often tell people, like, I know that foam rolling and all these things are uncomfortable, but it shouldn't really, the more it hurts doesn't mean it's being more effective. So you want to find that level of pressure and duration that you're using your foam roller lacrosse ball massage gun. It's going to be tolerable, it's not going to bring tears to your eyes, but it's going to help with your mobility and get rid of those trigger points that might be causing you issues. So, and really I'm happy if people do this any time of day, but like right after a run is a great time because that's going to help kind of reset everything, get everything kind of moving and circulating around to help you recover from your run. And this is more important after your long run or your harder sessions, like your speed work sessions. So if you can, I know a lot of people are going off to work and things like that, but if you can spare a couple of minutes to get on the foam roller and roll out maybe your major areas like quads, calves, and hips, that would be awesome. So thank you so much for joining and listening in and being a great audience. I'm assuming you're being a great audience. If you want to learn more about me and my practice, we have a website at www.precisionpt.org. We're also on Facebook and Instagram. We're pretty searchable there, but we are precisionpt_ATL on Instagram. Good luck and happy training.